Hello, I'm Ben and you're watching The PhD Parent. As reviewed in another video, it's common for mums to think that their milk supply is too low to meet the nutritional needs of their baby. Researchers call this perceived insufficient milk supply. Sometimes these perceptions can be wrong, but of course sometimes they can be right. And when milk supply is low, it's called actual insufficient milk supply. No surprises there. Turns out that there are two types of actual insufficient milk supply, primary and secondary. The former results from anomalies in the anatomy of the breast or medical illness, which leaves mum unable to produce enough milk. The latter results from problems with the way in which an infant is breastfed or infant-related problems. In the current video, I'll discuss research that's investigated each type of low milk supply. But first, how do you know whether milk supply is low? So I'll go into more detail about assessment of insufficient milk supply in another video. You can check out the link down below. But briefly, one approach for working out whether milk supply is insufficient is to record the daily number of wet diapers and poops a baby produces, whether a baby is showing consistent weight gain and growth, and by assessing a baby's level of alertness, skin color, and muscle tone. Others have argued that baby appearing satisfied after breastfeeds and mum's breast feeling full before breastfeeds and softer afterwards can also be taken into consideration. The rationale behind these indicators, as I understand it, is that if baby is going to the toilet regularly, they're putting on weight and they otherwise look healthy, then there's a decent chance milk supply is okay. If not, then potentially there is an issue with milk supply. However, the problem with these indicators is that they're an indirect way of assessing milk supply. So a complementary option for assessing milk supply that many researchers advocate for is test weighing. Test weighing involves weighing a baby before and after a breastfeed without a change in clothes or diapers. The idea is that 1 ml of milk is going to weigh about 1 gram. I don't know how that converts if you're in the US and not using the metric system. But anyway, if your baby drinks 100 ml of breast milk during a feed, then afterwards they should weigh about 100 grams heavier. It's recommended that test weighing be carried out over a 24-hour period. The reason for this is that you can't get an accurate gauge of milk supply from one feed, as the amount of milk intake per feed can be quite variable. So test weighing is a demanding procedure, especially if your baby is feeding a few times at night, which is probably partly why the approach is not carried out all that often. Now, not every study has obtained results that support the use of test weighing, but plenty have shown that it's an accurate procedure, at least when conducted under well-controlled conditions, using electronic scales that measure to the nearest 1 to 2 grams, and care is taken into account for spilled or vomited milk. Now, if you reckon it would be worth determining whether your milk supply is sufficient using test weighing, then it's strongly recommended that you first talk to a medical health professional. For example, a GP or lactation consultant. And the reason for this is just so that you can get properly trained in the procedure. So you don't want to just go out and buy a set of scales. Talk to an expert first. So that's how milk supply can be assessed. So now on to the two types of low milk supply, starting with primary milk supply insufficiency. So according to pretty much every paper I read, about 5% of mums experience primary milk supply insufficiency. However, I'm not entirely sure where this figure comes from. It may have originated from 3 sources. One is Feinstein in '86. In the discussion section of this paper, the researchers state that fewer than 5% of nursing mothers may be physiologically incapable of producing sufficient milk. But there's no reference to support this claim, and the paper has nothing to do with primary milk supply insufficiency. Another source is Neifert in 2001, who said that although most mothers are capable of breastfeeding successfully, as many as 5% of women may have primary insufficient milk supply. Again, there's no reference to support this claim. However, while not entirely clear, the figure probably comes from an earlier paper by Neifert, in a study of 319 mums. In this paper, the researchers found that by 3 weeks post-birth, 15% of mums were thought to have insufficient milk supply based on their baby's weight gain or lack thereof. 2/3 of these mums, that is 10% of the total sample, were thought to have secondary milk supply insufficiency, presumably meaning that the remaining 1/3, that is 5% of the total sample, had primary milk supply insufficiency. So that's where I'm assuming the 5% comes from. Whichever way you look at it though, there appears to be a distinct lack of research investigating the prevalence of primary and secondary milk supply insufficiency. But the important takeaway is that breastfeeding, like any bodily function, can sometimes not work. And so the idea that every woman is going to be able to successfully breastfeed just isn't true. Now, in terms of the potential causes of primary milk supply insufficiency, I won't go into detail other than to say that several have been put forward, including retained placenta, breast reduction surgery, infection, hypertension, and others. I also won't go into the potential treatment of primary milk supply insufficiency, because that's all medical stuff. The only thing I'll mention is that according to Neifert, if a mum has primary milk supply insufficiency, then unless the underlying cause can be successfully treated, and I'm assuming quickly treated, it will be necessary to supplement breastfeeding with formula to ensure that the kid gets adequate nutrients to grow strong and healthy. So now on to secondary milk supply insufficiency. So if about 5% of mums suffer from primary milk supply insufficiency, then about 95% of mums will be biologically capable of producing enough milk. But according to NEFIT, roughly 10% of mums nevertheless will not produce enough milk. This is termed secondary milk supply insufficiency. There are a range of potential causes of secondary milk supply insufficiency which fall into 3 categories. First, infant-related problems, and these can include conditions that result in an infant having an ineffective or weak suck, such as premature birth, tongue tie, anomalies of the palate, top bit of your mouth, or congenital heart defects. Second, suboptimal breastfeeding practices, and these can include breastfeeding practices that result in incomplete breast emptying, such as baby not latching properly, timing or schedule of feedings, and the overuse of dummies or pacifiers. And third, maternal medications, and these can include pseudoephedrine and progesterone-only or estrogen-containing birth control methods. Not sure if there are other medications, best to ask a medical health professional. Again, I'm not going to go into detail about these potential causes, although one caught my eye. Overuse of dummies. So I looked up the paper reference to support the claim, and I don't reckon the evidence was strong, at least based on this paper alone. Specifically, the reference was a study by Barros. These researchers examined the duration of breastfeeding to 6 months of age in around 600 infants who were using a dummy at 1 month of age. The results showed that more frequent use of a dummy when the kid was 1 month old was associated with an increased chance of breastfeeding cessation before 6 months. Now, for this study to support the claim that overuse of a dummy causes secondary milk supply insufficiency, you'd have to assume that early cessation of breastfeeding is a marker of secondary milk supply insufficiency. The problem with this assumption is that mums stop breastfeeding for all sorts of reasons. So, early cessation of breastfeeding is not a particularly good marker of milk supply insufficiency. And even if it was, the study was correlational, and you can't draw strong conclusions about causality when using correlational designs. If you want to know more, you can check out my video in the link below. Thus, I was not convinced. And in fact, when I looked into it further, I came across a review paper by O'Connor, who reported that in observational studies such as Barros, an association between dummy use and reduced duration of breastfeeding is often found. However, in randomized control studies, which provide a more powerful test of the hypothesis that dummy use causes early breastfeeding cessation, there is no such evidence. So again, not convinced that dummy use plays a role in secondary milk supply insufficiency. At any rate, being a psychologist, I have an interest in behavior. And so I looked into the treatments for secondary milk supply insufficiency when this issue arises from suboptimal breastfeeding practices. And I came across 3 such treatments: relaxation, increasing the frequency of milk removal, and increasing the degree to which milk is removed from the breast. For a more in-depth description of these interventions and to learn about the evidence for their effectiveness, then you can check out my video in the link below. For the moment though, that's it for actual milk supply insufficiency. If there's anything I've gotten wrong, any important research I've overlooked, or if you have any questions, then feel free to get in touch. Otherwise, happy parenting.